there permanently, though.
This is, once it's in, it is there.
Got it. Okay. So how do we get it in there?
So you go from the femoral vein, so the vein in the groin area, it goes up. If you follow the femoral vein straight up, it goes into the inferior vena cava, which is the major vein of the lower half of the body, and that vein kind of enters into the heart itself, into the right atrium, and then basically we go from the right atrium to the left atrium. This device comes squished or preloaded in a catheter, and that catheter goes up to the left atrial appendage. We basically deploy the device, and then we kind of do some stuff to make sure that it's in the right place and it's safe to leave behind. There's no leak behind it. And then we basically let go of it entirely, and that's pretty much it. Everything comes out from the groin. We just hold pressure. It only takes about a half hour, 45 minutes.
I took a look at it a second ago, and is it like attaching to the inside of the heart? Is that what it's doing?
Yeah, so there's anchors on the sides of the device that kind of anchor it into tissue, but really it's held in by the compression of the device. So the device is a little bit bigger than the appendage, so it kind of presses against the walls, and there's anchors that kind of help keep it in place. So the compression and then the anchors kind of keep it where it's supposed to be.
Okay. So until this was something that is, I guess, kind of commonly being done now, the common practice was just using blood thinners.
Yeah, so the gold standard has always been basically using a blood thinner to prevent blood clots from forming inside the left atrial appendage. People come to us when they're either having trouble with blood thinners or there's kind of some other reason to kind of come off of a blood thinner. So people that are falling or at risk of falling, that have had previous bleeding, or we just can't kind of get their blood thinners regulated. Those are the patients that we usually see to kind of have this device implanted. But and you're right, in the past, the gold standard's always been, let's just thin the blood so blood clots can't form.
So are there a lot of people, though, that are in that category where they don't take or can't take blood thinners for one reason or another?
There are. I mean, so certainly as we get older, we kind of run the risk of bleeding from anything, gastrointestinal bleeding or urologic or even neurologic bleeding. So the patient population that tends to come seeking this device is usually in the older side. But there are younger folks that we've put it in that have either had a significant bleeding event that we're worried about keeping them on a blood thinner long term.
So are you optimistic that maybe in the future this is going to be something more people are going to be able to do or just want to do?
Yeah, absolutely. So the trend is kind of getting towards what we call patient preference. So maybe they're not at risk of bleeding or falling or having a hard time with their blood thinners, but maybe they're just like, you know what, I'm a pretty active person. I don't want to be somewhere or be doing an activity and have a bleeding event and be in trouble. So we've had skiers that do heli skiing or something like that, and that don't want to be somewhere in the out in the wilderness and have an event, a bleeding event, and not be around help. So we see that a bit.
How does this thing actually stop blood clots? Please explain that.
Before we go into that, can we move to the
Question was, so how does this thing actually stop blood clots from forming?
Yes.
So the Watchman device is made out of like a stainless steel, a flexible stainless steel frame, and over the top of it is this very fine porous mesh. And what happens is that this mesh promotes something called endothelialization, which is basically the heart regrowing a lining over the top of it. And once that lining forms, nothing can kind of flow in and out of the mesh anymore. So blood clots aren't able to get out of the appendage and into the heart and then to the brain, and also blood's not able to get into the appendage anymore once that lining forms.
And why would you not want blood in that appendage? I don't understand.
So the appendage is actually a structure that's somewhat useless. It's kind of like your appendix. It doesn't really serve a purpose other than to just be a nuisance. And so, in fact, to the point, if somebody had open heart surgery and had a history of atrial fibrillation, they would actually cut the appendage off while they were there because it doesn't really serve a purpose. And so the appendage itself isn't vital to anything. It causes just problems. And so we don't want blood in there because it's in that appendage that blood flows very, very slowly, and it's in that appendage where blood clots have been found to form in patients with AFib.
So this is just for blood clots in the heart?
Correct.
Okay, because when I hear blood clots, I thought it was stopping blood clots all over the body.
No, so that's a great question. So people come to us and say, oh, I've had a blood clot in my leg or something like that, and if I get the Watchman device, do I have to stay on a blood thinner? The answer is yes. This doesn't do anything for blood clots in the leg or anywhere else in the body. This is just to prevent blood clots from forming in the heart and prevent strokes because of that.
Okay.
All right. Do you have any more questions? All right. I think I'm good. Doc, what's the best way to refer to you in the